Nurse Aide Test Prep Games. Question 1. When assisting a client to walk, the nurse aide should walk. Option A. Behind the client. Option B. Next to and slightly behind the client, holding the gait belt. Option C. In front of the client. Option D. Far to the side of the client. The correct answer is option B. Next to and slightly behind the client, holding the gait belt. Walk next to and slightly behind the client on the weaker side, holding the gait belt to provide stability and catch them if they lose balance. Walking behind doesn't allow seeing the client's face. Walking in front is unsafe. Question 2. Which statement demonstrates therapeutic communication? Option A. You should not feel that way. Option B. Everything will be fine. Option C. Tell me more about what happened. Option D. I know exactly how you feel. The correct answer is option C. Tell me more about what happened. Tell me more is an open-ended question that encourages expression, demonstrating therapeutic communication. You should not feel that way is judgmental. Everything will be fine is false reassurance. I know exactly how you feel assumes identical experience. Question 3. How should the nurse aide shave a client who takes blood thinners? Option A. With a straight razor. Option B. With an electric razor. Option C. With a safety razor. Option D. The same as any other client. The correct answer is option B. With an electric razor. Clients on blood thinners are at increased bleeding risk. An electric razor is safest because it reduces the risk of skin cuts. Straight and safety razors can cause nicks that bleed excessively. Question 4. When disposing of contaminated linens, the nurse aide should: Option A. Shake them out before placing in the hamper. Option B. Place them in a leak-proof bag without shaking. Option C. Fold them neatly before disposal. Option D. Sort them in the client's room. The correct answer is option B. Place them in a leak-proof bag without shaking. Shaking linens creates aerosols that spread pathogens. Contaminated linens must be placed directly into designated bags without shaking, sorting, or folding. Folding or sorting would require unnecessary handling of soiled linen. Question 5. A client is in the active dying process. The nurse aide should: Option A. Avoid the client. Option B. Provide comfort measures. Option C. Stop all care. Option D. Leave the client alone. The correct answer is option B. Provide comfort measures. Comfort measures such as repositioning, mouth care, and emotional support are essential at the end of life. Avoiding or leaving the client alone is not appropriate. Stopping all care would be neglect. Question 6. What is the correct order for putting on personal protective equipment, PPE? Option A. Gloves, gown, mask, goggles. Option B. Gown, mask, goggles, gloves. Option C. Mask, gloves, gown, goggles. Option D. Goggles, gloves, mask, gown. The correct answer is option B. Gown, mask, goggles, gloves. The correct sequence is gown first, then mask, goggles/face shield, and gloves last. Gloves are most likely to become contaminated and are removed first during doffing. Question 7. When measuring output, the nurse aide should record: Option A. Urine only. Option B. Urine, diarrhea, and vomitus. Option C. Diarrhea only. Option D. Vomitus only. The correct answer is option B. Urine, diarrhea, and vomitus. Output includes all fluids leaving the body: urine, diarrhea, and vomitus. These are all measured and recorded to monitor fluid balance. Question 8. A client who is withdrawn and refuses to speak to anyone is likely experiencing: Option A. Depression. Option B. Anger. Option C. Excitement. Option D. Anxiety. The correct answer is option A. Depression. Withdrawal and refusal to communicate are common signs of depression in the elderly and chronically ill. While anxiety and anger may include withdrawal with silence more strongly suggests depression. Question 9. A client with dementia has a tendency to wander. The nurse aide should: Option A, place the client in a locked room. Option B, provide a safe wandering area. Option C, use restraints. Option D, ignore the behavior. The correct answer is option B, provide a safe wandering area. A safe, enclosed area for walking addresses the need to wander safely. Locked rooms and restraints are restrictive and require orders. Ignoring the behavior is unsafe. Question 10. When receiving a report at shift change, the nurse aide should: Option A, ask questions about unclear information. Option B, write down everything quickly and leave. Option C, ignore information about client preferences. Option D, rely on the previous aide's verbal report only. The correct answer is option A, ask questions about unclear information. Asking questions ensures accurate communication and safe care. Writing everything down without clarification may lead to errors. Ignoring preferences misses important care details. Question 11. A client who is dying expresses a desire to talk about their life and experiences. The nurse aide should: Option A, redirect the conversation to something more pleasant. Option B, provide active listening and allow the client to talk. Option C, tell the client not to worry. Option D, change the subject to the client's care. The correct answer is option B, provide active listening and allow the client to talk. Life review is an important part of the end-of-life process. Active listening validates the client's experiences and supports their emotional needs. Redirecting or dismissing denies them this important processing opportunity. Question 12. The nurse aide is performing perineal care on a female client. The aide should: Option A, wipe from front to back. Option B, wipe from back to front. Option C, wipe in circular motions. Option D, wipe in any direction. The correct answer is option A, wipe from front to back. For females, wipe front to back, vagina to rectum, to prevent introducing fecal bacteria into the urethra or vagina. Back to front increases infection risk. Question 13. The nurse aide enters a client's room and finds the client on the floor. The aide should: Option A, pick up the client immediately. Option B, assess the client, call for help, and do not move the client. Option C, leave the room to get the nurse. Option D, document the fall and call the family. The correct answer is option B, assess the client, call for help, and do not move the client. The nurse aide should assess the client, call for help, and keep the client still to avoid worsening injury, possible fractures or spinal injury. Moving without assessment could cause harm. Question 14. The nurse aide's primary scope of practice includes: Option A, performing sterile procedures. Option B, inserting urinary catheters. Option C, assisting with activities of daily living. Option D, administering medications. The correct answer is option C, assisting with activities of daily living. The nurse aide's primary role is assisting with ADLS such as bathing, dressing, toileting, feeding, and mobility. Sterile procedures, catheter insertion, and medication administration require licensed nursing staff. Question 15. A dying client requests to see their pastor. The nurse aide should: Option A, tell the client the pastor is busy. Option B, contact the facility chaplain. Option C, change the subject. Option D, tell the client to pray alone. The correct answer is option B, contact the facility chaplain. Spiritual support is important at the end of life. The nurse aide should contact the chaplain or the client's clergy. Dismissing the request is inappropriate. Changing the subject avoids the client's needs. Question 16. After giving a client a back rub, the nurse aide should always note: Option A, the last time the client had a back rub. Option B, any change in the client's skin. Option C, the client's weight. Option D, the amount of lotion used. The correct answer is option B, any change in the client's skin. The nurse aide should document any skin changes observed during a back rub, such as redness, dryness, or breakdown. This is part of routine skin assessment and helps prevent pressure ulcers. The amount of lotion used, last back rub, and weight are not the primary observations to document. Question 17. A client with depression refuses to get out of bed. The nurse aide should: Option A, allow the client to stay in bed. Option B, gently encourage the client to get up. Option C, force the client to get up. Option D, call the family to get them up. The correct answer is option B. Gently encourage the client to get up. Gentle encouragement with support and assistance can help the client participate in care. Allowing them to stay in bed may worsen depression. Forcing them is not appropriate. Family members should not be expected to manage care. Question 18. When weighing a client, the nurse aide should: Option A, weigh the client at different times each day. Option B, weigh the client at the same time each day. Option C, weigh the client after meals. Option D, weigh the client before toileting. The correct answer is option B. Weigh the client at the same time each day. Weighing at the same time each day, example before breakfast, provides consistent, accurate monitoring. Different times, after meals, or before toileting can cause variations. Question 19. To prevent aspiration during feeding, the nurse aide should: Option A, feed the client lying down. Option B, feed the client with their head tilted back. Option C, feed the client in an upright position. Option D, feed the client only pureed food. The correct answer is option C. Feed the client in an upright position. Upright positioning, Fowler's position, 45 to 90 degrees, allows gravity to help food move down and protects the airway from aspiration. Lying down or tilting the head back increases aspiration risk. Question 20. The client's call light should always be placed: Option A, on the bed. Option B, within the client's reach. Option C, on the client's right side. Option D, over the side rail. The correct answer is option B, within the client's reach. The call light must always be positioned within the client's easy reach to ensure they can summon assistance when needed. Placing it over the side rail or in a specific direction doesn't guarantee accessibility. This is a critical safety measure to prevent falls when clients try to get up unassisted. Question 21. When assisting a client with a bath, the nurse aide should: Option A, bathe the client from cleanest to dirtiest areas. Option B, bathe from the feet up. Option C, wash the perineal area first. Option D, use one washcloth for the entire body. The correct answer is option A. Bathe the client from cleanest to dirtiest areas. Bathing from cleanest to dirtiest, face first, then upper body, abdomen, arms, legs, and perineal area last, prevents spreading microorganisms. Using one washcloth for the entire body is unsanitary. Question 22. A client with mental health issues is withdrawn and refuses to speak. The nurse aide should: Option A, talk to the client regardless of response. Option B, sit quietly with the client. Option C, leave the client alone. Option D, ask personal questions. The correct answer is option B, sit quietly with the client. Silent presence is therapeutic for withdrawn clients, who may not feel like talking but still benefit from companionship. Talking without response may be perceived as pressure. Personal questions may be intrusive. Question 23. When should the nurse aide count an apical pulse for a full minute? Option A, always. Option B, only if the client is pediatric. Option C, when the pulse is irregular. Option D, when the client is sleeping. The correct answer is option C, when the pulse is irregular. An apical pulse should be counted for a full minute when the radial pulse is irregular to accurately count all heartbeats. Otherwise, counting for 30 seconds and multiplying by 2 is acceptable. Question 24. A client expresses fear about an upcoming procedure. The nurse aide should: Option A, tell the client not to worry. Option B, acknowledge the fear and offer support. Option C, change the subject. Option D, tell the client the procedure is minor. The correct answer is option B, acknowledge the fear and offer support. Acknowledging and validating the client's fear provides emotional support. Dismissing or minimizing the fear, A, D, is not therapeutic. Changing the subject, C, avoids the client's concern. Question 25. What should a nurse aide do if a client refuses isolation precautions? Option A, ignore the client's refusal. Option B, use restraints to keep the client in the room. Option C, educate the client and report to the nurse. Option D, discontinue isolation. The correct answer is option C, educate the client and report to the nurse. The nurse aide should explain the purpose of isolation and report refusal to the nurse. Restraints are never appropriate without a physician's order. Ignoring refusal or discontinuing isolation puts others at risk.